Thank you, Joe and Lori, for a tremendous webinar today. It was very informative, and I am excited to see so many questions that we need to meet again to do some follow-up. So with that, we are going to get started today with you, Joe. And we had a really interesting question around, do California long-term care ombudsmen have jurisdiction in Los Angeles County public hospital facilities or other county-based public facilities?
Sure, that's a great question. We normally don't have jurisdiction in acute care hospitals unless they have a licensed distinct part skilled nursing facility. We would treat that portion of the facility, whether it's in the hospital itself or on the campus of the hospital, as we would a skilled nursing facility that's in the community. So yes, we would have jurisdiction if they've got a distinct part SNF. No, if they don't have a distinct part SNF.
That's great. And would you maybe mind explaining what a distinct part SNF is for those who aren't
Sure.
familiar?
Sure. A distinct part skilled nursing facility is a portion of the is a portion of the acute care hospital that is operated as a skilled nursing facility. It may be within the hospital itself, or it may be in a separate building on the grounds of the hospital.
Okay. So would that be the same as when I hear someone call them swing beds?
Generally, yes. The swing beds can revert to either an acute care hospital bed or a skilled nursing facility bed.
Okay, thank you.
Mm-hmm.
Lori, did you have anything you wanted to add to that?
No, not really. I mean, I think that similar to Joe's response, that's probably the way other ombudsman programs in other states also are dealing with it.
Mm-hmm.
I mean, generally, ombudsmen have jurisdiction in licensed facilities. So if there is a portion of a facility or a building that's licensed, that way, as Joe mentioned, there could potentially be access. But if you're not in California, certainly check with your ombudsman program about their jurisdiction.
Thank you. So to whoever who would like to pick this up, can you sort of give a comment on situations that arise when a resident's judgment may be considered impaired and some of their actions may not be safe for them or for others? Like, what are appropriate interventions and how can ombudsman assist in those scenarios?
Mm-hmm. Do you want to start, Joe, or do you
Sure, sure. I'll take a stab at it. So I think, the question for me is, does the resident really understand and have the ability to make an informed decision about what she or he wants? Is it putting the resident at risk? Is it putting the resident in danger? Is it putting other residents in danger? Is the resident able to understand the pros and cons of a particular action or decision and the ramifications of what will happen if the resident chooses to do something or chooses not to do something? We all have the right to make bad decisions, but those decisions should be informed by the risks and the benefits that are involved.
Mm-hmm. I think that's right. And I do also think that kind of getting at trying to understand why the resident might want to do that certain action or behavior might also help inform what their primary objective is there. And so is there an alternative that might be safe or that might be an appropriate behavior to which they can be redirected if necessary? And so ombudsmen can really work with families, with facilities to maybe understand a resident's motivation, knowing the resident, knowing what their history is, knowing what their preferences are could really help with that understanding and maybe to find a better solution.
Good point, Lori.
And I think what's so important is you're walking the facility through a process of getting to know the resident, of really helping them to understand their actions, which is what you're wanting in the first place, is some root cause analysis.
Exactly.
So in that same vein, how can we as long-term care ombudsmen encourage facilities to trust us and our motives, that we're really to support residents and facilities as we can to report issues to us? And do you have any thoughts on maybe why facilities might sometimes feel a little defensive of the long-term care ombudsman presence?
Well, I think, it helps when we try to explain to facilities that this is our job. We're the resident's advocate, and we're there to resolve problems on behalf of the resident. And um, when we bring things to their attention, it's not to make them feel bad or to tell them they're doing a bad job. It's to express um, a displeasure that a resident has with a particular situation, and we're just trying to resolve this on behalf of the resident. You may have staff who, may be reluctant to bring things to us because of a fear that they might get in trouble with their boss if they talk to us. And even though there are, laws here in California that protect facility staff who speak to us, um, there still could be a fear of retaliation from employers. Um, we want staff to be able to know that what they tell us will be kept in confidence, that we will, to the extent we can, protect their identities. But it's difficult. Staff sometimes are very reluctant to engage with us. But I think if they have a clear understanding or a better understanding that, we're there not to get them in trouble, but to advocate for the resident and to resolve problems that residents have.
Mm-hmm. And it certainly does seem that it's better to address the issues head on and try to resolve them right away before they escalate into something bigger. And oftentimes what we find is if one resident is having a particular experience or problem, they're not the only ones, that there may be others that are having similar experiences or problems. And I do think it's better to address problems when there are good resolutions that can be found and that's one of the things that an ombudsman can help do. While they are there as a resident advocate, they can help find and explore good solutions that will work for the residents and for the facilities as well. And it would be better to do that while you can address them than have something escalate where it's a more serious problem and might be addressed in a more serious way.
Mm-hmm. Thank you. So we have a really kind of hands-on question here, which is what resources are available for a friend or relative of a resident if they are not the responsible party, meaning they are not empowered to make medical or financial decisions on behalf of that resident, but they would like to at least be seeing the resident or know what's going on with them. So maybe tell us what kind of resources are available for that person who isn't, again, legally responsible, but would still like to have a connection with that person.
I think from an ombudsman perspective, when we encounter situations like this where there may be family members who don't have the kind of contact that they'd like to have with a loved one, we always try and reach out to the resident herself or himself to find out what the resident's perspective is. Does the resident want to have visits? Does the resident want to have contact with this person? And if she or he does, then we try and facilitate that contact with the resident's representative, with the facility, and with the relative of the resident, so that the resident can have visitors of his or her choice, and family members can see their loved ones.
Mm-hmm. I think, it's important to know that even if a resident is not able to specifically indicate that they want to see that person, because of dementia or some other cognitive impairment, if there's been a history of a relationship with that person, if there has been a history of visits or phone calls or communication that the resident has willingly accepted and wanted to have, then you can look at that as being an indication that the resident may still want to have a relationship with that person as well. And so, it's a reasonable thing to think that the resident would still want to have that relationship, and you can be advocating for that.
And I think it's important to remember that not everyone who we say is family is necessarily related to us, that the definition
Absolutely.
of family is a flexible one based on who you are as a person. And it's important for facilities and ombudsmen to be open to that conversation.
Absolutely.
Yeah.
So this is a really tactical question. I'm sure it's going to differ by state, but we have a volunteer field ombudsman here who indicates that they made a visit outside of a facility, and they found out several weeks later that there had been a positive case at that facility, and that the local ombudsman program was not notified of the positive till a significant period of time later. What can be done to assure that ombudsman programs are aware of the positives in facilities, that they're either notified or that there's data available to them?
Yeah. So, I think it's about transparency. We really want to know if there are positive cases in facilities, because as we resume these visits to facilities, whether they're outdoors or indoors, we need to be able to protect residents and our staff and volunteers. And so, while facilities aren't necessarily required to let us know, we would hope that in the spirit of transparency, they would. We would also encourage our representatives, as we have in here in California in phase 1 and phase 2, to check with their licensing agencies, check with their supervisors at the office, and to check with the facility themselves on the status of any positive cases in facilities.
Mhm. Yeah, that's a really good point, Joe. Transparency is really critical. And from the beginning of this pandemic, as advocates, as family members, as loved ones of people living in facilities, as ombudsmen, we've really struggled to get the information that's needed to really understand the full picture of positive cases, of what's been happening, of the true impact on residents. So this is something that nationally a lot of advocacy has been happening around, and it needs to happen not only federally, but at each state level to ensure that information is being shared. This is a public health
Mhm.
issue, and anyone going into facilities should have access to information about cases, about positivity of cases, and about what's actually happening there. So ombudsman programs absolutely should be getting this information, and that's something that should be advocated for with your federal and state policymakers and your community policymakers.
Mhm. Right. So Lori, I just have a good question here about sort of, can you recommend a good interactive presentation on residents' rights, or another presentation that's available in the Consumer Voice library that we could look to that talks about this?
So we have a lot of, excuse me, of webinar recordings around just a whole wealth of issues that can be downloaded for free. And you can access the slides, you can access some other materials that would go along with it on just a whole range of topics. And so those are available on the Consumer Voice website. We have a webinar tab where you can download materials and look at them. Also on the Ombudsman Resource Center website, we've got just a whole range of training programs and webinars that can be downloaded. We also have we do have an interactive um, uh, online component called Moodle Rooms that you can access some materials there. We've been putting more trainings up on that site as well. Nicole, if it would be helpful, I can send you some links to those that would be useful. But there's a range of those on the Consumer Voice website, and we've been particularly through this pandemic. Also, we've been holding numerous webinars for ombudsmen, both through the Ombudsman Resource Center and through the Consumer Voice, to assist with advocacy, to assist with rights issues, to assist with supporting residents during this time. That can be accessed for free on both the Resource Center and the Consumer Voice websites.
That would be very useful. We'll be sure to link those down below for the recording. Thank you.
Mm-hmm.
So we have one last question here, and it's really a question of, are there opportunities to train facility staff and help with their stress levels so that it promotes positive treatments of residents?
Mm-hmm. There are a number of training programs that are available nationally or through different types of providers that have developed them for specifically for facilities staff that talk about providing care, providing good care for residents. One example is one that CMS commissioned. It's called Hand in Hand. It's available through the CMS website, and it can be downloaded for free and used as part of the training. CMS has a range of activities, as do QIOs, which are available all around the country. And again, we, through the Ombudsman Resource Center and other resource centers that have been commissioned through the Administration for Community Living, also have a number of training programs that can not only be used with staff, but Ombudsman staff as well, particularly about reducing stress levels. We have been working with a doctor in Colorado, Dr. Sherry Gibson, and she has done a series of webinar trainings for us over the past couple of months that can be downloaded around reducing stress levels, interacting and taking care of yourself, so that you can also be taking care of other people. And we also did one actually just earlier this week with Dr. Susan Weary that's been recorded through the Consumer Voice on really looking at not caring for residents, but through reducing stress levels and handling challenging situations as you're essentially going back into facilities. And that might be useful for ombudsmen as well.
Excellent. Joe, do you have any closing thoughts or anything else that we should be aware of?
I think the last thing I'd like to say is, as we celebrate this month, Residents' Rights Month, it's all of our responsibilities to help protect residents' rights and to encourage residents to exercise their rights, especially, as we're coming up to the election. Residents don't give up their civil rights, their rights as a citizen to exercise their choice, and facilities have a responsibility to help residents exercise their right to vote. So, we've been really encouraging our local programs here in California to help get the word out, to remind facilities of their responsibilities. The licensing agencies have issued guidance around this, as well as CMS. And let's all work on this together to help residents exercise their right to vote.
Mm-hmm.
Absolutely. Well, I just want to say again, thank you to both of you for your time today. We appreciate it. We know that you were very busy and that this information has been very useful to ombudsmen and others across the country. So thank you so much.
Thanks, Nicole. Thanks for the opportunity.
Yes, thank you.